Everybody, with you Dr. Magdi Abdelrazik, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about what is rabies. Rabies is a zoonosis. It is infectious disease that is transmitted from animals to humans. What makes rabies serious infection? Animals with rabies transfer the virus to other animals and humans via scratch or saliva following a bite. However, any contact with mucous membranes or an open wound can also transmit the virus. The transmission of the virus is considered to occur exclusively from animal to animal and animal to human, while human to human transmission of the virus is extremely rare. There have been a handful of cases reported following corneal transplants. For humans who contract rabies, a bite from an unvaccinated dog is by far the most common cause. Once a person has been bitten, the virus spread through their nerves to their brain. It is a virus transmitted from rabid warm-blooded animals like dogs, camels, donkeys, and sometimes pets. And it is transmitted to humans by biting or scratching, and very rarely by transplanting some tissue such as the cornea. A rabid animal is agitated and nervous, like crazy. So what about the incubation period of the microbe in the human body? It is from 9 days to months, sometimes years, before appearance of symptoms on the person. It depends on how far away the bite from the brain, because the virus is transmitted through nerves to the brain. So, bites or scratches on the head and the neck are so to speed up the brain and spinal cord involvement because of the location of the initial trauma. For that reason, if you are biting on the neck, it is especially important to seek help immediately. Following a bite, rabies virus spread by way of nerves cell to the brain. Once in the brain, the virus multiply rapidly. This activity causes severe inflammation of the brain and the spinal cord, after which the person deteriorates rapidly and dies. At the same time, it depends on the number of viruses present in the wound and in the depth of the wound. So, symptoms of this disease: fear of water and air, headache, tension, hallucination. I remember a case I was called to treat it. They told me this boy is hallucinating. I went and I examined the child and I asked him, "What is wrong with you?" He told me, "I see people walking on the wall." I thought he was suffering from rabies, but his body had no signs of biting or anything else, no wounds. I brought a glass of water. The boy got really scared and refused to drink the water. Then I did hand movement in front of his face, and the boy was also afraid. I made sure that this boy had been bitten and maybe suffered from rabies. So I asked his mother, and she said to me, "No, he was not bitten." The next day, his aunt said to me, "Yes, this boy was bitten by a dog." When I hosted him and I did not tell his mother yet, and he did not take the vaccination, and we did not think that he had the disease. This what we are warning about, and we did this video for. The disease is deadly, and the mortality rate once symptoms appear is about 100%. Certainly this boy died at the mercy of God as a result of ignorance and the lack of awareness of the family. So we have to know what the animals which can transmit the infection. Also, cats can transmit infection, cows can transmit, also goats, horses, rabbits, all this can transmit the infection. Also foxes, monkeys, all these animals also can transmit the infection. What I wanted to say is that vaccination is very important for this disease. And also rabid dog lives for a week or 10 days, then dies. Regarding the vaccination that people who have been bitten should given. Once any animal bites you, you must first wash the wound thoroughly with soap and water. Disinfect it with betadine and cover it with a medical bandage. We prefer to leave the wound open, not to cover it unless it is large wound. In this case, we only bring the skin closer together, but we don't suture the wound. And for the antibodies that we give to the patient, if these antibodies are like globulin from horse, I give 40 micro per kg body weight. If from humans, I give 20 micro per kg body weight. It is a muscular injection that is taken in the gluteal region. Part of it in the gluteal region and another part is around the wound. Certainly this patient needs tetanus, and if we give him a tetanus toxoid, he will not need to make an allergy test. But if we give him an anti-tetanic serum, an allergy test must be done. At the same time, I will give him antibiotic because it is very necessary, and I will give him also a painkiller analgesic. With regard to vaccination, I administered the vaccination into the deltoid region muscles, and it is 5 doses on the first, 3rd, 7th, 4th, 14th, and 28th day. There are some people who works in circus or zoo or raise animals. These people, I give them only 3 preventive doses on the 1st and 7th and 28th day. And if animals bite him, I give him only 2 doses on the 1st and in the 3rd days. For pets, I give them only 3 preventive doses, and I must take care of these pets so as not to transmit infection to him. And I must pay attention to his vaccination schedules. In this video, we explain importance of raising awareness against this deadly virus. Thank you very much.